I am Kristen Reed, and I'm a research coordinator at the NCCMT, and I'll be giving you a little bit of an intro before we dive into the great work that's been going on with the PEEP project. So I'd like to thank everybody for taking the time to be with us here virtually today and to welcome you to another installment of the Spotlight on Methods and Tools webinar series. So today's webinar is hosted by the NCCDH and the NCCMT, as you can see on the screen. And we also have the pleasure of having a great team of colleagues joining us today to share their knowledge and experience on the topic of peer engagement and its important role in informing and supporting public health action on substance use and health equity. So again, thank you so much for taking the time to learn with us today, and we wish you a very warm welcome to those who have been able to join us this morning or this afternoon. So just to give you a bit of a background about your hosts for today. So this webinar is brought to you, as I said, from the NCCMT and the NCCDH, and we are part of 6 national collaborating centers for public health. For those of you who are unfamiliar, the NCCs, as we call them, are funded by the Public Health Agency of Canada and each hosted in different academic and non-academic institutions across the country. Part of why we exist as a whole in the knowledge translation field is that and part of what we hope we can contribute to today as well, is to reduce any duplication, share those learnings that we have from across different areas and jurisdictions, and really help to identify some of the gaps in knowledge and practice that exist. So as you can see here, each of the NCCs works in a different domain of public health. So this includes Indigenous health, environmental health, infectious diseases, determinants of health, healthy public policy, and methods and tools for evidence-informed decision-making. So we are joining you today from coast to coast with many people in many different places, as I can see in the chat, as is everybody else joining today's session as a participant. So thank you, everybody. You can please keep on sharing who you are and where you're from. I would like to take this as a thoughtful moment to recognize that here at the NCCMT, we are situated on the traditional territories of the Mississauga and Haudenosaunee Nations, which are acknowledged in the Dish with One Spoon wampum belt. And this wampum uses the symbolism of a dish to represent this beautiful territory that we are in today, that I am in today, and one spoon to represent the people who are to share the resources of the land and only take what they need. And so as we move forward with today's session, as well as with our busy lives and intertwined work and personal lives, I really hope that everybody can take a moment and have a chance to reflect on these teachings and both their historical and current relevance and value. So just to share a little bit more about your hosts today, as I mentioned, I'm part of the National Collaborating Center for Methods and Tools, and here at the NCCMT, we really champion the use of different types of evidence in public health decision-making and try to offer various methods and tools for using evidence when making these types of decisions. So our models here are used to kind of guide our thinking around evidence-informed decision-making in public health. And if you're interested, we have more information available on our website. So I think with that, Dan, I'll move over to you to introduce a little bit more about the NCCDH.
Oh, thanks, Kristen. You're hearing, this is Diana Wyko, and I am with National Collaborating Center for Determinants of Health. And we are located in the Mi'kmaq, which is the ancestral and unceded territory of the Mi'kmaq people. And, you know, I often think very carefully and very intentionally when we do a land acknowledgement, and as much as this has become a very common type of practice in a lot of circles, I always try and think about what it means to me personally. And as someone who grew up in Nova Scotia in a small rural community as a child of the 80s, it's interesting to reflect on how little I really knew when I was a child and when I was attending undergraduate here, and how little I knew and how little I appreciated about the history of Indigenous people in my own province. and let alone in Canada. And now that I know more, and now that I am trying to understand and learn more, I think it's just really important to remind myself how much further then we also have to go, and what my role is. I'm a white woman, and what my role is as a white colonial settler in that journey, and how important it is to keep trying. So also because we are a national organization, I would extend this recognition and thanks to First Nations, Inuit, and Métis communities across our country, coast to coast to coast. This is a little bit about National Collaborating Center for Determinants of Health, and here is a link to our website if you care to know and find more. And if there's ever any information that we can help you find related to health and inequities, then please do get in touch and let us know. So this is pictures of the NCC team. Diane and Kristen, who you've heard in the background, who is silent but very powerful, is our research assistant Danielle McDonald, and she is pulling the technological strings to make all of this magic happen. And certainly she is integral to putting these events on, and we're very, very thankful for her help and her time today. And these are our really wonderful speakers, and I am going to take a minute to say a little bit about each of them. We wouldn't be able to do this presentation today without these folks. Charlene Burmeister has over 10 years of experience in peer management and leadership. She holds several roles, including the Provincial Peer Coordinator for the BC Centre for Disease Control. She's the Provincial Peer Coordinator for the Compassion, Inclusion and Engagement Project, and she is the founder and president of the Coalition of Substance Users for the North. She's a board member of BC Yukon Drug War Survivors and the Canadian Association of People Who Use Drugs, and she was one of the first members of the project, the provincial advisory project called PEEP that we're talking about today, and she believes very strongly in the role and the leadership of people who have lived and living experience. And Paul Choisil is our other speaker today, and he started formally working in harm reduction 10 years ago, doing outreach with Vancouver Coastal Health. And through that organization, he was able to complete several capacity building courses. He can do facilitation, conflict resolution, trans inclusion 101, wellness recovery action plan, and take home naloxone training, which has allowed him to move into several different roles. He's a peer mentor, he's a peer advisor, and while he maintains his work with BCH, he's also been part of the PEEP Provincial Advisory Committee that we're hearing about today. So these are two folks that are the absolute experts in the work that we're hearing about, and with them has been the dream team. So on the line also we have Kurt Locke, who is with the BC Centre for Disease Control, who has been helping coordinate between the NCCs and Paul and Charlene. And later on in the webinar, we're going to hear from three members of the PEEP program, Sherry and Jenny and Beth, who will help participate in the question and answer period. So there is an entire huge group behind all this wonderful work that's been happening. And with that, I'm going to turn it over to Charlene and Paul for the presentation. Take it away, guys.